Today, of course, is Max Healthcare Institute. It's after a big rejig that Radiant and Max has now come together and spoken about it. Earlier in the day, I actually spoke to Abhay Soi, MD and CEO of Max Healthcare. It's, of course, a historic day for them. Mubina, a great listing, second largest by revenue. Let's hear out the interaction.
It's it's not only an amalgamation of two companies, but I think it's amalgamation of a lot of individual journeys that many of us have taken together. 24,000 strong team of healthcare workers that we have, and we all just took a pause just before the listing because to recommit ourselves to the best of clinical programs, the best governance, and to us, frankly, it sounded more like the starter gun than the gong of the listing.
So, let's start with the entire business now. Can you just introduce the company to our viewers in the new avatar? Which businesses it include? I think it only operates in very key cities like Delhi and Mumbai. So they are very high margin, high volume business. Can you just introduce the company to our viewers?
Yes, so now we've emerged as the second largest hospital chain in India in terms of revenue. We are largely metro-centric. That means 85% of our total capacity is focused in metros, predominantly Delhi NCR, but we also have presence in Mumbai through Nanavati Hospital. Other than that, we have hospitals in Mohali, in Bhatinda, both of which are PPPs. In fact, the Mohali hospital has been showed up in various government papers as perhaps one of the most successful PPP models available and which is in operation at present. We also have a hospital in Dehradun. So essentially we are a high-end quaternary care player, super specialized services, and predominantly positioned in the metros.
Right. In terms of margins, I was just going through your presentation. There was something which was called as EBITDA that you all have delivered, something which is the normalized EBITDA. Can you just explain how are you taking this COVID impact? How will FY22 be, especially the first 3-4 months that you've seen? How have things changed in the last 6 months?
So I think clearly last year we started at FY19 Max Healthcare was at a EBITDA margin of about 9.5%. That's what it closed with. But exit Q4 we were in the lookout of exiting at a 19% EBITDA margin. But on the 21st of March, just 10 days before the year end, the pandemic hit us and the lockdown, and kind of was the last 10 days was quite a washout. And so was most of April for us, and occupancy had actually plummeted down to 28%. But I'm happy to say that since then it has been a gradual uptick in occupancy, and now we are operating at about a 67-68% occupancy levels. We believe the worst is behind us from that standpoint, and of course Q1 is going to be onerous on most healthcare players, including ourselves. But I think since then we've been, EBITDA positive, and we're looking forward to a better year for the rest of the year, and hopefully FY22 in its entirety will be back to normalcy.
So one, of course, is the problems of COVID and how it is impacting the sector. But what would you say about the sector itself? So let me just tell it for our viewers. We've seen a new acquisition in Fortis. Apollo has gone into different streams. They have acquired and tried to make an asset-light model. Then we have now Radiant and Max coming together, becoming the second largest player via revenue. You think all of it is changing the dynamics of the way the sector was operated?
So I think clearly there seems to be some sort of a generational change which has happened over the last couple of years in the healthcare sector. Like you said, there's been a change of ownership in IHH and Fortis. If we look at Max again, there's been a change at the helm. So it's also a confluence of new management, people not only from Max, Radiant, but as well as other people we added from outside. So clearly I think it's new times for the sector. I think perhaps what has happened in the past is many people have tried to replicate the success in metros, in other non-metro markets, and in other businesses, asset-like businesses such as diagnostics and so on, which has perhaps had some sort of bearing on the ROCEs. But going forward, we see a lot of people coming off, capital expenditure cycles. So I see that kind of slowing down in terms of greenfield at least. A lot of balance sheets have been impacted through this COVID. So it will throw up opportunities for consolidation as well. Really, I think over the next couple of years, I see not much asset creation happening from a greenfield standpoint, but perhaps a lot more consolidation opportunities. Which will allow healthcare players, at least the ones with stronger balance sheets and better margins, to consolidate and perform. So, I mean, exciting times. If you actually see, we also see that clearly, I think, a larger share of the wallet, whether it's from a government GDP spend standpoint or, from a personal wallet standpoint, be it in terms of people purchasing more healthcare insurance and so on. So it's going to be, in the medium term, at least it should work positively for the healthcare sector.
Right. We recently spoke to Cipla and they were of the view that, the way the Indian pharma industry is catering to doctors will change. A lot of it will happen digitally, which means a lot more reach could come in, a lot more cost could be saved going ahead. How would you say that for the hospital sector with the sort of doctor consultation that you're seeing online, the way you're trying to reach different kind of people? What sort of opportunity does it get for the sector?
So I think not only the healthcare sector, but if you look at across sectors, digital has been in the core of some, but in the peripheries of many. But going forward, one thing is very clear, most will have to embrace it, and digital will have to be at the core of most businesses. What we've seen is through the pandemic has given us a good boost. 16 to 17% of our total OPDs have gone on to digital, have been on the form of video consults. And I think going forward, it also gives us an opportunity to reach out to as many people as possible at the most reasonable price while still being viable. So clearly, I think digital is a great opportunity for outreach of the healthcare sector, both domestically as well as internationally. So I think, clearly if one was to embrace it, which we have, and it's going to be at the core of what we do going forward, it should play out very well.
Right. Let's talk about this healthcare crisis that we are seeing. So, of course, people are managing it well now. Of course, things, despite the number of cases increasing, at least on the hospital level, at healthcare level, is not something which was as scary as it was 2 months back. Let's talk about the bigger picture. What does this do for the healthcare sector in the long run? And I'm not only talking about India healthcare spend, what's happened here, people realize about, healthcare spending. What do you think will happen globally? Will a substantial amount now be spent as a percentage of GDP on healthcare versus what it was being done earlier by various governments across the board?
So I think clearly it's going to be, I think the whole world has faced a common challenge, and it's really going to be on the top of mind. It's not going to be something which is going to be forgotten in a hurry for decades to come. So clearly we are seeing a lot more focus towards this. It also means a much better public-private partnership model in order to tackle not only this pandemic, but going forward other pandemics as well. And I think, like you rightly alluded, most of us are much better prepared for it now than when we were, perhaps right in the beginning of this pandemic, whether from a regulatory standpoint, supply chain standpoint, and so on and so forth. I think, we have some silver lining in terms of the pandemic moving away from the metros where it had been for many months. We've seen the pandemic has lasted in most places for 4 to 5 months, and then it kind of moves out. But I think the concerning point is that at aggregate level is increasing across the country and is moving to now tier 2, tier 3 cities, which perhaps have a lesser amount of infrastructure over there. So, that is probably going to be a matter of concern. It's a pandemic which has, which has been seeded or has come to the metros first and then has moved out. So while you see in most cities in the world, most countries in the world, it started in the metros, but I think the concerning part is now it's going to a little more disenfranchised parts of the countries, and we're probably seeing that in India as well. So I think we will also see a lot more expenditure, a lot more focus towards rural creation of infrastructure for healthcare.
Right. Just a last word on, you mentioned about the merger with Max, how complex it was, how time it took in terms of, things happening in. But now that things are final, it's been listed. Of course, you have been operating, apart from the listing as well. What sort of benefits do you see, or what sort of synergy benefits do you see as you gain this size and you become the second largest player by revenue?
So I think we have a significant amount of synergy benefits which will play out, and why I say that is because, to me, critical mass and a certain size, so geographical concentration is what creates a lot of synergies. We have a large critical mass in the Delhi NCR region, which again is perhaps the most attractive micro market in India, because it not only drains the Delhi NCR region, but also all of North India, Central India, Northeast India, as well as what 40% of the global medical tourism comes to this particular place. It's also a fact that the best or the most highly regarded healthcare professionals, doctors and clinicians, also reside in metros, and a lot of them do reside in the Delhi NCR region. So it gives us a strategic advantage from that standpoint, and I think the geographical concentration is something which is going to bode us well going forward.
That was the man of the moment, Abhay Soi. Of course, it's a very, very special day for them at Max Healthcare Institute. It's a listing that they have done. The full big merger that they had planned is something which has now gone through. On that note, we